Good evening. Welcome back to my No Name channel. I'm Bruce, and this is another Bali COVID-19 update for December 6th, 2020. And let's get started. The schedule is down below the timestamp. Okay, numbers. 91 new cases in Bali. That gives us a total of 14,781 confirmed cases. 13,177 have recovered, 446 deaths, and 1,158 active cases. So, and our numbers are starting to creep up again, as I mentioned last time. And let's take a look at nationally. What do we have nationally? I'll tell you why in a minute. 6,027. 569,707 total cases, 470,449 recovered, 17,589 deaths, and 78,774 active cases. So, we're a long way from home. A long way from home. I hate to sound discouraging, but well, I'll talk about the country in just a minute. Let's take a look locally. So, out of that 91 number, 89 are local transmissions and 2 domestic imports from Tabanan. Numbers, Denpasar are 27, Tabanan 25, Badung 18. Gianyar 15, Bulalang 5, I'm going to talk about Bulalang in a minute, and Jembrana 1. And what about Bulalang? Well, there's 5 here, but this is a cluster that we have in Singaraja, a local finance company. Link is down below, and a total of 11 people have tested positive for that company, and the local authorities are keeping track on the situation. So, and what about the country as a whole? We'll come back to Bali in a little while. The country as a whole, on Thursday, Indonesia had the highest single-day number of 8,369. The National COVID-19 Task Force spokesman said that the rising numbers could be attributed to a lag in real-time data synchronization between the national government and regional administrations. So he's urged regional administrations to send their COVID-19 data in immediately to the National Task Force. And he also mentioned that there's been a reported decline around the country in public compliance with protocols. Okay, people here, just like people everywhere else in the world, they're getting tired. I was talking to a friend of mine in China yesterday night, and she said, we've been talking about this for almost a year now. And I said, yeah, it's amazing, almost a year. Only 9 of 512 regencies reported people properly adhering to the mask wearing. Okay, mask wearing is a big thing everywhere in the world, and the government needs to continue to try to enforce the protocols, and the Indonesian government has decided to reduce vacation time for, I guess it's for the civil servants. It didn't say in the article, it's down below, in order to try to prevent another surge. And yeah, we're just getting surges all the time. Okay, so yeah, these are not great. Not great numbers. And what about the vaccine? Well, the Indonesian government has green-lighted major COVID-19 vaccines. And so what about that? Well, the start of vaccines around the world, with the start of vaccine approvals around the world, the UK is getting ready to start vaccinating people. It looks like they're going to be the first people in the world to do this. With that in mind, Indonesia issued a decree this week to allow vaccines by certain drug makers. And the vaccines that can be used for vaccinations in Indonesia must come from the following. The local pharmaceutical company, PT Biopharma, the UK-based AstraZeneca, China's Sinopharma, and Sinovac Biotech, or the U.S. Pharma Moderna. And Pfizer is also included in this. So people are waiting to see what's going to happen in the UK. The UK has received some criticism about the Pfizer vaccine, that they skipped several parts of the trial, but they've denied this, and it said that everything is above board and everything is safe and they're ready to go. The Indonesian Food and Drug Monitoring Agency, a BPOM, everything in Indonesia has initials, I never know what any of them mean, said it will not grant emergency use authorization to the vaccine from Sinovac. And the plan was to get started in the next couple of weeks of vaccinating people. But the emergency use authorization is not being approved because, according to a spokesperson, there is a lack of data on its effectiveness. And the BPMO head said that approval could come in the third or fourth week of January. So still ways off. And think about the logistics of vaccinating people in Indonesia. Well, the government has identified priority groups once the vaccine is available, and the first priority group be 3.5 million people. This are the frontline workers. This is medical personnel, military, police. Second priority group, religious and community leaders and local authorities at the district, village, community, and neighborhood level. That's 5 million. Third priority group makes up 4 million, and those are teachers at various levels. The fourth priority group, 2 million government officials and legislative council members. And fifth priority group, members of the Healthcare and Social Security Agency, better known as BPJS, Kesehatan. I have medical insurance through them as well. And their fees are paid by the government, and there's 57 million people that will be targeted there. And so, vaccine is not going to happen when the government said. It seemed pretty ambitious to roll it out when the government wanted to, and yeah, that's not happening. So we'll wait and see what's going to happen. And what next? Nursing deaths. So if you've watched this channel, you know one of my children is a nurse. Always worried about her. The Indonesian Medical Association updated fatalities for medical and health workers in Indonesia. It's now 342 deaths. 192 doctors, 14 dentists. I'm going to go see my dentist on Tuesday. And 136 nurses. 75% of the nurses who died were stationed in patients' rooms. And according to the spokesperson from the Indonesian Nurses Association, what's the PPNI, it's possible that they contracted the virus from patients who hadn't been tested yet or who were asymptomatic. And the PPNI chair said that the government and health facility management needs to immediately provide hospitals with the best possible equipment in order to get COVID-19 test results quickly, as well as routine virus tests for healthcare workers in order to help curb virus transmission and save lives. Amen to that. And a spokesman for the Indonesian Medical Association reminded the public to drop the view that the virus is a hoax. We have that view. Ooh, hear that? I'll talk about that right at the end. Thunder. So yes, there is this belief around the country in various parts that the virus is a hoax. Of course, you find this everywhere in the world, unfortunately. And the spokesperson added that the rising rate of fatalities among medical workers is a huge warning that everyone needs to continue to be cautious and comply with health and safety protocols like hand washing, mask wearing, and keeping social distancing. And neglecting the protocols means that you are putting your loved ones in danger. Remember that. And from the Indonesian Medical Association's mitigation team, a reminder for colleagues in the field to continue to comply with standard operating procedures when dealing with COVID-19 patients, including maintaining their personal protective equipment in good working order. Okay, so none of this is particularly good news. Any good news? Yeah. Okay, there is some good news. And good news from the home front, from Bali. Okay. According to the managing director, Ardita, from the Nusa Dua Hotel, occupancy rates are going up. So, for the holiday, going up an average of 30%, and that's the average increase in domestic bookings for the period from December 24th until New Year's Eve. And some hotels are up as much as 60%. Who are these? They're domestics, they're locals. We're going to get another surge of people from Java, I'm guessing, for the Christmas, New Year's period. And he said this is attributed to holiday promotions and discount packages that the hotels are putting out. It is. If you are here, a lot of great bargains. If you want to get out and go have dinner or spend a couple of days in a nice hotel just to get away, drop the kids off in the pool and sit back and relax. He said that it's necessary to continue to abide by health and safety protocols. Notice that everybody is saying that, so maybe that tells you something. These are the people that are trying to keep the country going. So he said that it's necessary to keep this up, that he's noticed that people are not all complying with this, including mask wearing and physical distancing. And he further said that Indonesia and Bali need to have health protocols that not only meet our standards, but meet international standards and meet the standards of the countries that we want to come visit us. And who is that? Well, as I talked about last time, you want the Chinese, they're our number 2 group. You want the Australians, number 1 group. Are they going to come I'm going to talk about that in just a second. So he said that we need to do this because for all countries around the world, the safety of their citizens is their first priority, and they will not be letting people visit countries where they feel that it is unsafe. And right now with us, So, okay, so good news. Some domestic business. So there's things going on here. Okay. So, what about a wrap up? Okay. Is Bali going to open? Right. No. Like I said last time, I was way off when I said I thought that it might open by Christmas. It ain't going to open at Christmas, like I said last time. Not going to open for New Year's. Are people still coming? Yes. They're still coming on the B211 visa. You can get here. Apparently this is okay. For tourism in general, no, that's not happening. We're not going to have the regular tourist visa on arrival, folks. That looks like, well, I don't know. I haven't got a clue. But if we're going to start vaccination at the end of January or February, with our numbers like they are, I think you're looking at spring at the earliest. Well, American spring. So March, April, May. I was listening to a news report about America talking about baseball not getting back to normal until September. And if you've been taking a look at what's going on around the world, Korea was up 600s this week. Japan, I was talking to a friend of mine who's a doctor in Japan. He said same thing. Bad situation there. So, and of course the U.S., which is the leader in death and illness in the world. So, yeah, that doesn't look good. It doesn't look good for international tourism right now anywhere in the world. Will things come back? Yeah, eventually. But for now, if you need to be here, you can get in on the B211 visa, like I said before, and if you want to come just for a couple of days, I'm sorry, that's not going to happen for a while, maybe quite a while. So there are some initiatives going on to get away from the craziness of relying on tourism so much. And I'll mention a couple of those in my next COVID-19 update. And so that's it for today. Stay safe, follow the protocols, especially if you're here. Be part of the solution, not part of the problem. And be kind to someone today. Thanks for viewing. See you next time.